Hey guys, welcome to our channel. Today's topic is severe acute malnutrition. Before going into the detail, let's see what is malnutrition. Well, this term emphasizes both on overnutrition as well as undernutrition. Overnutrition associated with overweight and obesity, and undernutrition refers to multiple conditions including acute and chronic malnutrition and also the micronutrient deficiencies. So, what are the different categories of this acute malnutrition? The first one is moderate acute malnutrition, the second one is severe acute malnutrition, and the third one is global acute malnutrition. So, we will focus and study basically the severe acute one, which is severe acute malnutrition. Severe acute malnutrition in infants who are 0 to 5 months of age is defined as weight for length or weight for height if the score is less than 3 of the WHO child growth standards median, or the presence of bilateral pitting edema and the visible severe muscle wasting and low birth weight. So these criteria are for assessing the severe acute malnutrition below the age group of 6 months. And if the age is more than 6 months, we can also have one more criteria, which is mid upper arm circumference. If it's less than 11.5, then it can also be the case of severe acute malnutrition. But below the 6 months of age, MUAC cannot be used. Let's talk about the etiology. Low dietary intake, low sanitation level, low birth weight, and infection. So, what sort of infections would be there? Diarrhea, pneumonia, upper respiratory tract infection, immunization, and culture taboo. So, that would be the types of infection you can see.
Hello guys. Uh, for the treatment of the severe acute malnutrition, the WHO has given a protocol point or a regimen to be followed and checked for the treatment and recovery from the severe acute malnutrition. It is as follows. There are several steps, and for each step there is a time duration for which the treatment should be given for each step, and a follow up should be taken. Uh, so the regimen is as follows. For hypoglycemia, we took care of the patient for 2 days, in which we treat the low sugar content by providing the patient with 5 ml per kg of the 10% of dextrose solution IV, followed by 50 ml of 10% dextrose solution with nasogastric tube in the initial stage. After that, we gave hypothermia treatment for 2 days, in which we provide a warm, humidified environment to the patient and also use radiation or conduction for providing warmth to the patient. For the treatment of dehydration, we provide the patient with the dextrose solution as said above and normal glucose or water. The hypoglycemia, hypothermia, and dehydration treatment is taken up for 2 days for the complete recovery of the patient. After that, electrolyte maintenance should be a continuous process, and it should be maintained throughout the whole duration of the regimen and recovery phase, that is up to 2 months or 6 weeks. For prevention from infection, we give broad spectrum antibiotic therapy for up to 1 week. Micronutrition is provided with and without iron. For first 7 days, micronutrients are provided without iron, and after 7 days, the micronutrition is provided with iron. Initial feeding should be started uh, for 7 days, and catch up growth is monitored after 7 days and up to 6 weeks. Sensory stimulation should be continuous to check whether the malnutrition condition doesn't take a toll on the musculoskeleton and sensory system of the body. It is rare, but sometimes malnutrition affects musculoskeleton, muscle growth, and sensory stimulations are also affected sometimes. It is rare, but we should provide proper sensory stimulation to the child. After that, follow up is taken after the first week of treatment and up to 10 up to the 2 weeks or 2 months. So there are 10 things that should be taken care of, that is hypoglycemia, hypothermia, dehydration, electrolyte balance, prevention from infection, micronutrition supplementation, uh, initiation of feeding, catch up growth, sensory stimulation, and prepare for follow up. As we can, as you can see in the given table. That's all for today. Thank you and have a nice day.
Hey guys, for all the upcoming videos notification, kindly subscribe our channel and press the bell icon button. For any feedbacks and suggestion, you can give it in the comment section. And if you want to suggest any topics for our further videos, you can suggest it. So thank you guys. See you soon with our next video. Bye bye. Take care.